2, 1. We are live now.
Good evening, everyone. We welcome you all to Monday Motivation Webinar again. This is what, season 3 or 4, Dr. Tushar?
Season 3.
Season 3. Yes. So let's hope that we restart this with a bang. And I would like to introduce today's speaker, but I would hand over to Dr. Tushar Agrawal to introduce today's speaker.
Yeah. Hi, guys. And we are back again with Monday Motivation. I hope we are able to bring few interesting episodes this year. And the kickstart for this season's Monday Motivation is none other than our friend Shefali Batra, who has now authored a wonderful book, and her authoring the book actually kick-started the whole episode. I'll just briefly share on a PowerPoint, and then you will be able to be with us better. So this is what she is now. She's a psychiatrist and a cognitive behavioral therapy consultant. She'll explain in her own words what is CBT. So she is an undergrad from Nair. She's a postgrad in psychiatry from KEM. She's got a healthcare management qualification from California. She has spent her time all over the world, and she's actually a global wellness consultant. I have gone through the book in bits. It's a little heavy book. You guys must read it. And though the title says depression, it's not really about being clinically depressed. It's for people who every once in a while would feel sad. You know, and most of us, though we would claim that we are successful orthopedic surgeons, but every once in a while we would feel that things are not going our way, be it professionally, personally, or at any other sphere of life. So hopefully today's evening's discussion with Dr. Shefali will help us come understand this concept a little more, acknowledge what's happening to us, and how to improve our mental health. Some interesting excerpts from the book is, one statement is that this book is designed to provide thinking tools that will nourish the incentive to morph yourself into the best version of your own being. So heavy it was that I had to sort of write it in the PPT. I could not remember the statement. A depression is like common cold of psychiatry, but with a capacity to kill you. And the best, my favorite statement here is, hope itself can change life eternally. So the flow of things today will be, we'll talk to her about her journey as a psychiatrist in brief, her journey as an author in detail, and then we will shift to the book, and then we'll take her expert guidance on certain mental health issues that we may face in our day-to-day life. So, Shefali, as I was, you can hear me, right? Everything is, yeah. So great. So Shefali, briefly tell us how you entered into the realm of psychiatry first.
Well, we're all doctors here. We know how we get into medicine, and we know how the whole rigmarole goes. And
so the book says that she was actually eligible for a surgical seat, and when she went for
in
her,
Pune, not in Bombay, no, in Aurangabad, somewhere. But yeah, that's what I mentioned.
But her counselors were completely shocked when she said no, but I want to do psychiatry. So she was hell-bent and she was cut out for the profession. So now you tell us, at what point of your life did you really decide that you need to write this book?
You know, I have been asked, I do a lot of cognitive therapy, which I don't know if everyone's aware. Cognitive therapy means changing how you feel by changing the way you think, and changing how somebody thinks is just not easy, because all of us, including me, we're very, I shouldn't talk for everyone, but yes, we are all pretty rigid and pretty stubborn, and we think that what we think is right. You know, we are wired that way to believe. It's a very self-preserving mindset. But to have that awareness that sometimes your thinking may be taking you to the wrong direction, that is the basic premise of cognitive therapy. Now, I realized early on in the day, you know, from the first few days of psychiatry at KM, you know, that OPD, day 1, 100 patients, do CT all, you know, just ask kaise ho, you know, kaan mein awaaz aati hai, man mein kaisa lagta hai, standard 3 question, manat kaisa vatte, चांगलं वाटतंय, उदास वाटते, भीती वाटते. That's your diagnosis of depression and diagnosis of anxiety. And कानात आवाज भास येते means there, you're schizophrenic. It was pretty short in that sense. But after those 100, old cases, which we used to call the CT all section, that's when the real, what I call, fun part of things was to understand. The first day I had a patient who was suicidal actually. So it was an incomplete suicide. She had consumed, young 16-year-old, she had consumed something to, harm herself. And she was, sitting there, and I didn't know Marathi and she didn't know Hindi or English. And that is like from the day, my expertise in Marathi, मनात कसं वाटतंय, कशाला तुम्ही असं केलं, now Marathi comes pat. So the things that people teach you, my first case of hysterical conversion when, met this lady with this one half of her body, numb on this side and like a, I don't know if you heard of hysterical conversion reactions, because depression after the death of her husband and Ardhangini. So my right side has died, and so she was paralyzed on the right side of the body. It was just, by then, of course, I had gotten into psychiatry. So I can tell you now, I believe that I was just born to do this because I love doing it. And a lot of people ask me, oh, so you like listening to people's problems? So there's a different way of saying it. I mean, it's not that I love listening to people's problems, but I love helping people out of their problems. So that's my perspective. People say, how can you take listening to negativity? I said, but I'm adding positivity. And that itself makes me positive. Yes, I feel a little sad when I can't help somebody. That's when they're so rigid, but eventually they change. If they really put their heart and soul into it and they listen to me, they will change. So today I can say that I am lucky, when I see people who are talking of career switch, who are talking of, I'm not happy with what I do, at least I would never complain of that. There would be things alongside which may worry you and trouble you. But in general, I don't think that there's anything about my profession which I don't really enjoy, at the point of, what it gives you, the satisfaction that I can make a difference. So that MAD are my golden words, not mad, not mixed anxiety, depression, make a difference. So I think my work allows me to do that. Of course, everybody, I am, by the way, a classic orthopedic case with carpal tunnels and 8 trigger fingers and frozen shoulder, and every doctor makes a difference. I'm not belittling that part, but I just knew that psychiatry is just different. It's just got a twist and every case is different and it's fun. So that's what I like. The challenge is fun. That's what brought me to do this.
So tell me the challenge of going through the process as an author, pen it down, to put it all into a book and to actually bring it out, publish it. It's quite a big challenge. Many of us would be, aspiring to write a book. Many of the audience among the orthopedic surgeons who listen, they also would be having tons of patients whom they may be wanting to convert it into a book.
Yeah, but in like a lot of people or authors write positivity books and books on wellness, and they're not all essentially doctors, right? I mean, all of these authors, but of course, to write an orthopedic book, you've got to be an orthopedic surgeon. In my case, I had been hearing it since a while from a lot of patients, doc, you need to write a book, we would love to read. And I kept saying, I'll write a book when I'm 50 because that's when I'll have time. Of course, I'm not disclosing my age here. I'm pretty close to 50, but I was actually I was approached by the publisher in 2020, October. This was bang in the, center point of the lockdown, like throughout 2020 and to the mid of 21. So this is the center peak point of the lockdown when I was approached by JECO. And they said that, depression is on the rise. I said, tell me about it, reading statistics in the world. At that time, it was proposed that 1 in 3 people are depressed. Like the depression rate was about 27 to 30% in the world. That means 1 out of every 3. So that is a pretty crazy number. So they said, we want a book, and they told me the title, You Can Beat Depression. I was like, okay. I mean, I didn't want the word depression, because all sadness is not depression. But I said, okay, they told me, I've heard JECO has approached me, like a publisher approaches you. And just a few days before, the patient asked me, doc, you need to write a book. So I said, okay. They said, you think about it. I said, okay, I'll get back to you. And I took a week and I already started thinking. I started penning down all bits and pieces of paper. I was in the US at that time. It was me and my cat. Oh, my cat is here. Me and my cat. And
Hermes.
Hermes is my cat. Oh, he's in the book. I have mentioned him in the book. So I started writing, like, what do you write on depression? So I started just scribbling notes on in that 1 week, when Jaiko said that you tell us if you want to write. It was totally mind-boggling. What should I write? So a lot of these little bits of paper and tissue paper and writing paper and, the little notes started coming up with topics. And even when I'm going through my patient notes right now, some old patients, I'm finding in the middle, I've written notes about my book. So I'm recalling that 2.5 years ago, I was doing all of that. And then I told them in a week, I said, okay, I'll write. They said, okay, start writing. Send us the table of contents. I don't work like that. I live a day at a time. I'll decide tomorrow what chapter I'll write, So today I just have to start with something. And then, so it changed a lot. The whole style changed as I went along. And just a new idea would come. I would see a patient in an appointment. I say, hey, this point I have to write. So in a way, with a daily practice of seeing those 8-10 patients a day, and then going over what they were feeling. So they pretty much, they didn't willfully, do it. But of course, everything is anonymous.
It was evolving as you were writing it.
Was evolving. I am absolutely like that. Nothing comes at the outset. It always evolves. I've always liked that style. So I never know what I'm doing in the next 1 or 2 days because the plan just comes up. And I believe that I don't think you should really rigidly plan because the plan will never go your way. So we should let it evolve. And that's how the book happened. But of course, eventually it got structure and then, the table of contents came about and it kept changing too, like you said, evolution. But at some point, yes, somewhere around in 1 year, they gave me 1 year and I went a little before time. On 30th September 21, I gave them the final manuscript of the book. I remember it was my late father's birthday. Like he was there at that time on 30th September 21. And that's when I submitted the book. And then I thought, they said, now we'll take 1 year to edit it. I said, I haven't written the book so badly that you need a 1 year to edit it. Why 1 year? Then you realize that it takes that long for a publisher to go through the whole series of commissioning editor and then the copy editing. And then they took 2 months, on the cover page. And knowing me, I kept having my to and fro. I said, please, can we have it this way? Can we have it that way? Then I myself suggested, so I designed the cover actually. So it was, it's simple, everything, there's a lot of time and then the typesetting and then everything came up. It was an interesting journey to write a book. I'll actually say that through the last year, I have said it 100 times. I'm never writing a book again. I'm never writing a book again. But now that it's done, I am saying that, yeah, I'll write again. I don't know when, but I will write again. So
yeah, hopefully maybe every year we have a book from you.
I took 2.5 years to write one. Every year won't happen. It will take me a year to get over this one.
Few things which I would want to ask by briefly going through your book is, I understood that it's all a concept of redefining your life. So redefining the life events which are happening, right? And you mentioned that you tend to feel extraordinarily sad and almost depressed if you tend to dull a very colorful image, means if you just choose to,
it's the color that you add. Yes.
Yeah. So how does that actually come about? Because see, I feel I have read somewhere that the default program of a human being is to be happy, but actually as an adult I find it's probably the other way. The default program is probably
because the default program is rewired. See, every newborn baby by default is going to cry. Every newborn baby by default, when he's put on the mother's breast, he's going to be happy and content and will go to sleep unless there is a colic, unless there is some other problem that we're dealing with, a pathology. But the newborn, all he needs is the breast and that comfort makes that child, that infant, that newborn happy. So happiness is inherent, contentment is inherent, have very basic needs fulfilled, and then it becomes easy to be happy and content. I don't even know if happiness is the goal. I think contentment is the goal. But as we grow up, it's the life experiences, the way we experience those experiences, the way we endure those experiences, and maybe the learnings that we are given around and about it, or sometimes we aren't given that learning. We aren't given that love and care and attention that we wanted. So we start changing our schema of the world. For the infant who gets his milk, he thinks the world is a very nice place because the moment I cry, I'm taken care of. And likewise, as we grow up, and the support and the love that we get from people around, if we don't get that, so early experiences do matter. If we don't get that, then we start believing that the world is a bad place. And then we generate a self-fulfilling prophecy. So then we gradually start projecting our fears on the world, and gradually, like slowly, the cognitive biases get evolved. These cognitive biases or thinking errors is what has given rise to the cognitive theory of depression. That because I'm seeing it, like imagine if you're colorblind, you will not be able to see the colors, right? So as an eye, a pathology, colorblindness is easy to understand. But imagine someone who is emotionally colorblind, who cannot see colorful emotions because of that brain wiring. And that's why there is the biological theory. But the biological theory is brought about by negative experiences. It's not how did chemicals just change by themselves, unless there's like some head injury or trauma or, a stroke. There we understand, we talk of left frontal lobe, right frontal lobe, mania, depression. But when you're talking purely, why did this happen? Because so many events, if you see that chapter, I think you read the initial few chapters, that people who go through the same life events, why is it that they deal with it differently? Why does every person with a breakup not get as sad? Why do some people move on?
You mentioned siblings also, or we
Siblings.
can even take care of identical twins who completely respond differently to life events.
Exactly. So which means that though the genetic composition is the same, why would they react differently? The same event happened with them. If I'm talking of twins, then they've gone through the same adversity or something in childhood, but they still react differently because of the way they think. So maybe the support that they got, which made them think in a particular way. The golden, the triad in any negative emotion is that I am no good, the world is no good, and nothing will ever be good. Now, if you keep these three beliefs, I'm no good, people are no good, and nothing's going to get better, what is left besides sadness and depression in the life of a person who thinks like this? These are the three core beliefs which make you sad. And then if you twist and put them in many different forms, people should treat me nicely, breakups shouldn't happen, I should never lose my job, I should get what I want. The more and more we think of beliefs like that and make them absolute, that's how we start feeling negative. So we are wired to be happy, but it is us who changes it. If we switch the lens, we might see things differently. It's like without glasses, I mean, even I'm blind, I can't see anything, but the world becomes clearer if you wear the right glasses. So cognitive therapy is like those right glasses with the right curvature and right focal length to get you to see things rightly.
In the right perspective. Now, tell me one thing. Is that why are some people wired to handle these negative life events better than others? Is there a reason to it? Okay. Or and also you do mention in your book that negative thinking is, as what I understood from the book, is that negative thinking is a very difficult thing to get rid of. Means it's a habit which
Because
you form and it's pretty
yeah,
difficult.
like negative
It's a
thoughts
very
are like,
sticky thing.
they stick. You said we are wired. I don't know whether we are wired to be happy, because as soon as we are born, also we cry. As soon as we are born, first thing is we cry. Then we get milk and then we get quiet. So that means in the chicken and egg story, first the crying came. So it sounds like we are just the crying type. If you really look at it, look at all human beings. Aren't we always crying? Like it's as if it's never enough. Most people, I wouldn't say all, but even I would say I'm also cribbing and complaining. This is not enough. That is not enough. Health is not good enough. It's too hot and it's too dark and it's too light and bright and so on and so forth. So we have too many demands. If you look at Maslow's hierarchy, whatever, we have needs. You can't deny the fact that we are needy creatures.
And they keep rising as you keep
Need,
going up.
then need, and then it becomes greed, and so on and so forth. So needs and greeds are the root cause of everything, right? You follow any philosophy, Buddhist philosophy, Jainism, I mean, it's all about needy and greedy people. So that's where a lot of problems start. But again, demanding, there's nothing wrong. I want this, it's fine, I want this. It's okay to want it. I want a better car and I want a better everything. But the point is, am I okay without it? How flexible am I? That's where flexibility in thinking becomes very important. And what happens in depression, in anxiety, in anything negative, is that we're not flexible because we are seeing it that it didn't go the way I wanted it. And that rigidity in thinking becomes the problem. And imagine pegging on a cognitive bias, pegging on the fact that everything should be my way. Imagine if that word should. You've read the chapter on shoulding?
No.
The chapter called shoulding. So it's that should statements, because the only place we should use should is to say that should not be used. Because the moment should comes in, you're just, then your thinking becomes black and white. These are all cognitive distortions. Shoulding is a distortion. Black and white thinking is a distortion. Catastrophizing that it should be this way, otherwise it's the end of the world. So firstly, you start with the should thinking. Then you go black and white, that if it's not this way, that means it's the worst. And then it means it's the end of the world. So there in one line, I've given you 3 cognitive distortions: black and white thinking, catastrophization, and shoulding. But it seems like so simple. Then even I wonder, it's a pretty fat book, 336 pages. But it's just the examples. It's example after example of, patients and clients, and literally every story is real. People think I'm creative, people say I'm creative. I wonder if I'm creative because I always feel that everything that I create comes from somewhere. It gets inspired from something or from someone. Even when I do my artwork or whatever, there will be the insides of a walnut, or there'll be something of a lemon, or somewhere where I'll get the idea from. So I feel creativity also comes from observation. And that's where I feel like I am quite a storyteller in that sense. Even in my TED talk, it's like story after story, about people. So like people think, wow, what a story. It's not a story. It's not some screenplay. It is a real life event. And people are surprised to see how people think, people who see me. Obviously, they come with a range of issues. They come with a range of concerns, which you and me would never have imagined that people actually go through this. And this is how they think. Just this afternoon, my sister was telling me how many problems people have. But listen, I don't have any problems only. What is wrong with me? My real sister asked me that. I said, it's because you don't think like that. She said, but my brain doesn't know how to think only negative. I said, because you are wired that way and you're lucky, and be thankful. Because she's so good with everything. She never gets stressed about anything. So it's just your tendency.
So I'll interrupt you. So you think we can rewire ourselves differently?
Absolutely. You've heard of the word neuroplasticity, right?
Yes.
In every medical science, I mean, you also
It's
know
like the big word now, the
the biggest word.
neuroplasticity.
So the statement goes that
But it does take a lot of practice, right? As an adult to change your, you've got to check yourself very regularly and
Yes.
keep correcting yourself.
The flexibility is important. The moment you're rigid, you'll break. Or you'll just be stuck.
And persistence is very important. You have to keep checking yourself that am I good? Am I thinking negatively?
And so to change your negative thinking, you first have to identify that it is negative. So there is the chapter, not the chapter, the section. No, the chapter is called Identify the Kink in the Way You Think. So that is, where is that chapter? So there is one chapter called Twisted Thoughts Trigger Negative Emotions. So, it's all about the twisted emotions. But yeah, in the part 3, which is techniques to break cognitive distortions, I'm just looking at it here. So chapter 19 says identify the kink in the way you think. So that's introducing how twisted thinking and this whole, there are 8 techniques to untwist thinking. So I'll just read out the titles, they are, it says technique 1, it's a little poetic, arrest your negative thought and put it in a witness box. Break perfection if you want to beat dejection. Quit blame and shame. Play the what if game. Use adjectives that define, not labels that malign. Change your locus to gain better focus. Stop shooting around and stand on buoyant ground. Think before you leap, for the waters might be deep. Quit black and white because gray might be right. So this looks like a little poem, but 8 entire chapters on untwisting thinking. So there are a lot of checklists and questions and, basically, if you just read it, you will be able to test, am I thinking in black and white? So you won't need me anymore if you have my book. So you'll ask yourself, oh, I'm catastrophizing. Then you'll do the next set of checklists. Like every chapter has about 3 or 4 checklists.
Checklists,
Pretty
yes.
much. So you have about, I don't know, more than 40 checklists in the, 40, 50 checklists. And then the questions you're supposed to ask yourself when you are thinking negative. So they set you in an alternate thinking process. And so there are like small stories, which are narratives of people. And a lot of people have told me, Doc, you've written my story out there. I said, no, this is not your story. It's someone else's, but it looks like my story because everyone goes through this. So that's the sort of interesting part of the book, which I've heard from a handful of readers, including the editor, that Doc, it sounds like you've written it for me. So I just think it's nice when you get that feeling that, hey, this is my story.
Yeah. So it is sort of practically applicable to most of us at some point of time.
Absolutely.
Right? So I've been reading a couple of other books like Martin Seligman's. He says that we tend to have this problem of permanent, personal, and pervasive. So he says that we feel that all the disasters that are happening to us are permanent and it's only happening to us and nobody else. Yeah, and like what you said, we catastrophize it. Like we feel that the whole kainat is conspiring against us. So, I have to tell that to a couple of my patients also sometimes when they are magnifying their problem, that you may be having a big pain, but technically it's a small disease. Vis-a-vis sometime you may have no pain, but a big disease.
Yeah. But that's what Martin Seligman, I don't know if people know, I'll introduce a little. So 2 more P's, positive psychology. So he brought on this school of positive psychology. We talk of like, when would you go to a psychiatrist or a psychologist? When there is something wrong. That means something negative has set in and now I need help. Like even this book, Why Do I Feel So Sad? At least I put the word sad.
So it's not that you have to be minus 16 and come to 0. He says even when you're at 0, you want to go to plus 16.
No, if you are 95, we'll get you to 100, So positive psychology means that just get better and better. We're not even thinking negative. We're only on the positive side of the spectrum. That's what positive psychology is, that we are thinking of how to become more positive by not even being negative. If you stay positive, I mean, that's exactly the opposite, right? I mean, if you keep filling your cup, it's just never going to get empty. So that was his theory of positive psychology. And the P's are the premise of cognitive therapy too. So there is the chapter on personalization and there is the chapter on, and when you're saying pervasive and then the catastrophic thinking. So all of this is covered. This is what happens. So first identify the kink in the way you think, and then you untwist your thinking. So, we're getting from the kink to the untwisting.
For our audience sake, if you may just sort of differentiate between CBT, REBT, and
ACT?
ACT.
Okay. So actually CBT, REBT, like REBT is a variety of cognitive therapy. So CBT is cognitive behavior therapy. REBT is rational emotive behavior therapy. ACT is acceptance and commitment therapy. All these three are technically CTs, cognitive therapies. Now, cognitive therapy means change how you think. Cognitive behavior is change how you think, and that will change your behavior. Purely changing thinking is really hard because thinking is influencing your behavior. So CBT has become the gold standard. REBT is actually a very fun technique. In CBT, we are identifying the cognitive distortions, that how you've twisted your thinking. You're shooting too much, you're catastrophizing too much, you're thinking black and white, you're taking things personally, you're filtering as if you're taking a sieve and you're just filtering out all the positive and the negative is staying back. So all of these are cognitive errors. So in CBT, which is premise of the book, is you are identifying the cognitive errors and untwisting your thinking and seeing the impact it has on your emotions and behavior. So that's classic good old CBT proposed by Aaron Beck. Then we have REBT, Rational Emotive Behavior Therapy, a variety of cognitive therapy in which we talk of the ABCDE. Have you heard of it, Dr. Tushar? ABCDE, no? So I'll tell you the ABCDE of REBT. So A is the activating experience. Okay, first I'll tell you ABCDE. A is the activating experience. B is the belief about the experience, which is irrational, which leads to C, a consequence, which is usually negative. Okay. Then when I come into the picture, or a therapist comes into the picture, you get to the D, which is dispute the irrational belief. And then E, enjoy the effect of the rational belief. So starting with A, B, C, D, E, what most people know is the C. They just know that I'm sad, I'm upset, I am miserable, I am angry, I am anxious. Okay. And people think that the A caused the C. I didn't get the job, and so I'm unhappy. My girlfriend left me, and so I'm unhappy. I'm getting divorced, and so I'm miserable. Right? The A leads to the C. People forget that it's the B in the middle. The belief, which is irrational. If I didn't get a job, it means that I'm never getting a job. And so I'm unhappy. If I told you, you didn't get this job, but you're getting the next job with double pay, would you be unhappy? No. But it's your belief in the middle, which is irrational. So REBT is quite, similar to CBT, but it's just a sort of a different way in which, even when I teach it to my patients and clients in 20 years, I teach them ABCDE, and then I give them homework that identify your C. So C, everybody identifies, I'm upset, I'm angry, I'm sad. And then when I ask them why, they are just not understanding. They think that I lost my job, I lost my spouse, I lost something, I didn't get something, and so I put on weight.
So it is not the adverse event, but it is the belief about the adverse event which is causing the whole problem.
Yes, that's the quote that goes, it's never the problem which is a problem, it's your reaction to it which is, but your reaction is based on a belief.
So if I may just quote an example from my own practice, I do pediatric orthopedics. So we have these patients of cerebral palsy. Now it's a lifelong problem with the parents, but some parents cope so well. And the father would come and tell me कि doctor, ये ना normal नहीं है मुझे पता है, लेकिन इसके आने के बाद ना मेरी इतनी तरक्की हुई है, मेरी इतनी progress हुई है, means he's redefined his whole life. और डॉक्टर मैं तो घर आता ही इसको मिलने के लिए हूँ. मतलब he is in sort of a semi-vegetative state. He can hardly move. He's wheelchair bound. His son, but he enjoys his son company to a level which I cannot describe humanly. Yeah, so that's his belief, right? Yeah. Now vis-a-vis some other patient who is just not able to adjust to the fact that his child has got cerebral palsy, and he leaves the wife and the kid to manage on their own. So
no, I used to even go to
event is exactly the same.
Yeah, no, it's perspective, because I have been to, these schools for with kids with CP. They're just in such a bad state because all the kids invariably were abandoned by parents. I used to see 85-year-old grandparents bringing a 8-year-old, 9-year-old kid, because it's just the perspective that people aren't able to see things for what they are. It's the reaction. It's how you choose to react which defines who you are. So likewise here, I mean.
No, but is there a control on this? That's what I'm trying to ask you.
Bring it under control, Then the question is, are you living your life or someone else's? Are you running your thoughts or someone else's? You run your own mind, right? Unless we're under the influence of alien forces. And if you tell me you're under the influence of alien forces, I will call you schizophrenic. So the point is, we drive our thoughts, we drive our behavior, we drive our emotions. A lot of people say, Doc, I don't know why, I just feel sad. So that's not possible. If you just think that not if you think, because you're not thinking, if you just feel sad without knowing why, you're missing the fact that I'm thinking in a certain way, which is making me feel sad. So technically, by that theory, by cognitive theory, you can't be feeling something unless you're thinking something. You can't just say, I'm feeling scared. I'm feeling scared of going to the aircraft because I think it'll crash. I'm feeling scared of the elevator because I think I'll get stuck and I won't be able to breathe.
Or I'm feeling scared of a social event. Means
because people will judge me. You cannot feel scared without thinking something. I'm feeling angry with my friend because she didn't call me on my birthday, because I thought that she was supposed to wish me. There's always a reason. So that is the premise of cognitive theory, that you can't just, an event cannot just cause a reaction. I mean, like that, if a kid has never even known about whether a snake is a scary thing or something, we'll have kids who would love to go around and play with snakes. We feel scared because we have been known and
because of our past experiences.
Because of experiences or the learning. What is conditioning? That we change our behavior based on some experience of the past. So we either endure that experience or we study about it. And so we become afraid of it. So that is it.
So as I understand from you and a bit from your book is that there is a method to change your thinking and to rewire our brains, right? Towards feeling, towards choosing a more positive, more favorable behavior.
Yeah, you know, a lot of people will say, hey, just be positive. You know, that's the difference between a mental health professional and a friend. Even your friend will say, hey, be positive. You just snap out of depression, you know, just like it's a snap. But it's just not a snap. Kitna bar snap finger karenge, the depression hasn't gone. So here we're giving you the technique. You know, like if you look at, let me, for example, if I open to a chapter just on very small chapters with, so let's say there's this chapter on labeling. Okay. How when we label ourselves, oh, I didn't get that job, I'm a failure. Or I didn't pass the test, I failed, you know, so I'm a failure. Now here I've, you know, given the explanation that the label is not stuck on your forehead. You know, when we put labels like loser, failure, things like that, they get stuck. You know, then I'm running around with the label loser. But here I've given the example of a mother who says that I'm a bad mother. I'm the worst mother because I don't have time for my kids. But instead she could say, I'm a busy mother. You know, I'm an overworked mother. I'm probably a little disorganized mother. I'm a little distracted mother because I'm working or something. But when you say I'm the worst mother, it becomes a harsh label. When you put it as a busy or an overworked mother, it becomes a softer label. You know, so I've given a lot of these examples. And for example,
Tony Robbins calls it the metaphor. Use the right metaphor.
The right metaphor, yeah.
Metaphor, yeah.
Similar cognitive technique.
So tell me one thing, in neuro-linguistic programming, no, they teach something called as the swish technique. You know, it's a very rapid change of mindset to feel more favorable when you feel things are not going your way. You feel that works?
So you want to give an example of the swish?
Like for example, let's say you see a vada pav and you feel like devouring the vada pav, and actually using the swish technique, you see a vada pav and you can convince yourself that you need to go to a gym and do and have a great sort of
so again,
so actually a vada pav, which was bringing the emotion of devouring it and hunger, you can actually convert it into an emotion for actually doing a workout.
But that would not, like I know what you're saying, because
it would not last, I feel.
It would not last. That's the part about enduring. That's that chapter, why you can't snap out of depression. So there is actually a chapter that for a moment you can do something, but how is it going to endure? How is it going to be a little more longer lasting? For the instant gratification, for not the gratification, for the instant way, anything is fine. You switch something, you, like you said, you instantaneously, you want to avoid the urge, yes, but on a longer term, how many times at some point you'll give in, unless you totally thoroughly work upon the idea and change the way you think about it. There won't be a way for you to permanently wear that, you won't even need armor anymore. You will be so inclined towards positivity that you won't be able to be negative again. That is how cognitive therapy
So
works.
that's called ANT, right? Automatic negative thoughts.
Yes,
So,
I call them ants that bite.
so you feel roughly how much time does it take for somebody to get out of it?
There are a lot of my patients ask me that, but I have some people who say that even one conversation with you, doc, this one thing stuck. I don't even know what stuck because I talk so much that, so many things can stick. But they take back some ant challenging technique. Invariably, even my normal lingo has become like that because there'll always be some quote or there'll always be something to challenge something negative. So you could change your life in, it wasn't a quote, but I read it in one of the journals that because I had spoken at a biological psychiatry, global conference of biological psychiatry, I'd spoken on how CBT changes the brain more permanently than medication in mental health conditions. So CBT can rewire the brain. CBT changes the DMN, which is known as the default mode network of the brain. So all of that is what CBT does. And the principle really is that that neuroplasticity, that change, evolution is possible, but just with consistent effort and with putting in that change, it will work. So that's why no instant gratifications, no instant switches, but persistent effort. And so it's not easy. It's
not
going
easy.
to take
That's
time.
what you mentioned in your book. It's not easy.
It will take time.
It's like, how do you have to go to repeatedly to a gym to build up muscles? So to build
Something
up
like
those
that.
stress,
But even if you repeatedly work out, you get a six-pack. If you stop working out, that might go. Here, what we mean by stopping working out is more on the lines of the mental workout. Like, I don't think once you start thinking positive, then you suddenly become negative. I think if you've learned the art of positive thinking, then I think it becomes like a permanent armor. And you are protected. That's why when people come to see me with a sort of a negative life event, after we work together, 10 other issues of their life get sorted because they're changing the way they think. Right? So it becomes like a magic weapon. It's like you want to see the whole town as red. You don't have to go around painting everything red, right? You just have to wear red sunglasses and everything will become red.
So in that ABCD thing, you have changed the B very powerfully.
There's only the B which you have to change.
So the adverse events keep happening, which they are going to keep happening. And
the belief system has to be rational and it has to not be negative. And if the B is not negative.
So I want to ask you one thing. Some people have an overtly positive way of looking at things, unnaturally positive. And
like
that
in mania or
no, not mania, mania. But
you're not unrealistic.
That may prevent them from actually progressing. Would you?
Yeah, you're trying to say like only a positive
like for example, somebody may have a very self-defeatist thought that boss apne ko, I have got like 12 out of 20, so it's not great. Somebody else may say, I'm so good here. I'm getting 12 out of 20. Last time I'd got 10.
Complacency.
But
again, the person who gets, I call this the bronze medal syndrome or the consolation prize. Look at the sound of it, consolation prize. I don't even know. You heard of it, right? In school, first, second, third is gold, silver, bronze medal. Fourth is called consolation prize. The poor guy was almost suicidal. To console him, you gave him a prize. But I don't know why in the nomenclature we put things like that. It just makes us, this competitive world, it obviously makes it sound like if you're not at the top, you're not good enough. But I'm saying it sounds odd because people who knew me in childhood, because I had to stand first and I had to get the gold medals and I had to get all of that. I myself pushed myself really hard. At some point in school, there was a general knowledge quiz, inter class, and I had got 48 on 50 in my GK exam. No, I had got 49, but I didn't get 50 on 50. And when they came, they obviously picked me. She got 49 on 50 in GK. I said, but I'm really bad. I didn't get 50. And they started laughing. And that year we won the GK quiz, in that I was in 8th standard or something. I'm thinking back and laughing that just because I didn't get 50, I thought that I was not good enough. But of course, I wasn't going to do something drastic or extreme about it. I just kept studying harder. But, and the person who gets like 37%, for example, throws the biggest party because he passed. And the person who gets 95 and didn't get 98 is invariably, some of them even go on to commit suicide. So I think, of course, it's perspective and we should engender a healthy perspective. So I even have that chapter called Break Perfection to Beat Dejection, though I am a perfectionist myself. But there is something called healthy perfectionism versus unhealthy perfectionism. So over perfectionism is a term in which you've taken the perfectionism to an unhealthy extent. So a little bit of it's okay. It's okay doesn't mean it's okay to be substandard. It's okay to not be the best, but I will try harder. That mentality gets you ahead.
That's what is now all about growth mindset.
Growth mindset.
I'm not there yet, but I'm on the journey.
I'm on the journey and I can get there, and I don't know whether I'll take a week or a day, a day or a week or a month or a year. But as long as I know that I'm directed there, look, I may have an accident tomorrow and I won't survive tomorrow. But at least I will go with that mindset that I was on an upward trend and I will get somewhere. So I think that is something we need to be a little more mindful of.
Tell me something, how, from your book, how do you tell them how to sustain this? That's the $1 million trick. How
the mindset. But I'm telling you, some changes, look, even if you lose weight and look all nice and, with the weight loss, you may still gain it back. But I feel if you developed a positive mindset, if you realize that you should not use should, or if you should not see things in black and white, or you should not catastrophize and not see things like that's the end of the world. I think if you learn that, if you master that, you will never ever see anything negative again. See, it's almost like I used to be non-vegetarian earlier. I've given up the idea. I won't let murder become a meal. So I am always going to stay veg. I don't get attracted to it. So I don't have to ever worry about being attracted to a non-vegetarian dish. Likewise, if you become positive by nature and choose to not use cognitive distortions, if you untwist your thinking, then you will always see positive. I mean, that becomes an obvious fact. So that is sustenance. You understand it in the first place. It's like an emotional vaccine. You will never be negative again.
So if you choose not to drink alcohol, what you're trying to say is, then you may be able to get rid of drinking alcohol altogether.
Incidentally, I don't drink either, but yes, because it's just not attractive. So you become tuned to not drinking. You become tuned to vegetarian. You become tuned to thinking positive. It's all actually the same thing, but here giving you the techniques to get there. So if you don't think black and white, if you don't catastrophize, if you don't take comments personally, there is a whole, I can narrate all of them. There are the 10 chapters. If you don't filter out the negative, so all of these things, if you become tuned to, you won't be negative ever again. That is your vaccine. You will just not fall prey to negativity. But you've got to inject yourself with the vaccine. So
yeah. So that's the $1 million trick. So what you are trying to say is work hard, get rewired into positive thinking, and vis-a-vis, as against the physical thing, the mental thing is much more powerful.
Absolutely.
Once you are into it, it's going to happen. Now, I want to ask you one thing, is there is a book called Rethinking Positive Thinking. So where they are saying that, they divide students into two groups, and one group is told to imagine that they've cleared all the exams and they've got their jobs and everything is going well, like the secret book tells them. And the other group is, no, you guys are pretty screwed up.
Nothing is going to
performed better than the first group. So we came across a theory. They created a theory which is called wish outcome obstacle plan. So you create a wish, you visualize your whole wish. Let's say like I have a hospital, so like I want to do 100 surgeries a month. So how to do that 100 surgeries? But at the same time, just by visualizing the 100 surgeries happening is not going to happen. I've got to visualize all the obstacles which are going to prevent me from doing those 100 surgeries, and also make a very clear-cut
Action plan.
plan to overcome. So your
This is
thoughts on
like,
this?
you know, another Tony Robbins plan called the RPM method. It's called the result purpose massive action method. That keep the goal in mind, keep the purpose in mind. You're moving backwards. RPM, result purpose action plan, but also it's known as the rapid planning method. But the RPM is result purpose massive action. Why massive action? Because you have to massively put in the effort, keeping the purpose in mind to attain the particular result that you want. So, but these are all different techniques. Like personally, my strategy is different. I want to do good. Now, I will do good by doing this, or I will do good in this way or another way. Like, I would not refuse an opportunity where I can do good. No, people said, if you weren't ready to write a book, if in your mind your book was going to happen at 50, why did you write it at whatever age I am? So, I didn't have an answer. I just thought a book will do good. And so I did it. See, it could be that I don't really think. Like that movie Zindagi Na Milegi Dobara. The guy says, I want to retire after 40. And she says, you don't know if you'll be alive after 40. So I think whatever you want to do, just do it now. So that's just another school of thought, another way to think, you know. So I think there are many such tippani, as we call it, so many different things that can change our lives. So I think get your mantra and figure out what works best for you.
Right. So we are sort of coming to the end of our discussion. So what I'll try to conclude. So first is you got to recognize that you are into a habit of negative thinking. You got to recognize that this habit of negative thinking is not really working in your environment.
Not working for you.
Yeah. And you got to understand that there is a nice scientific, logical way of getting out of it, which is completely proven. Like for our orthopedic colleagues, when we tell our patient, boss tablet Dynapar दिया है तो पेन कम होना चाहिए. अगर पेन कम नहीं हो रहा है तो ये पेन नहीं है, कुछ और है. So similarly, if you are having,
it's not so direct. You know, sorry, I'm hustling. I was trying to give a quote, but I think I know the quote since I've written. Let me narrate that quote. Yeah, how does it go? I just can't find it, that chapter. If you place your nose on the grindstone rough, and if you keep your nose on the grindstone rough and you place it there for long enough, then very soon, if you place your nose on the grindstone rough and you keep it there just long enough, in time you'll realize there is no such thing as a brook that babbles or a bird that sings. Then only three things that your whole world compose: you, the grindstone, and your ground down nose. So when you're sitting with your nose on a grindstone and you're thinking that this is life, and you're rubbing your nose on the grindstone, so you will not realize that you'll realize there is no such thing as a brook that babbles or a bird that sings, because you're stuck in your negative world. Then only three things shall your world compose: you, the grindstone, and your ground down nose. So get out of that mode, because you're sitting with your nose on the grindstone and grinding it and not realizing that there's anything else good in the world. So that's where that rigidity, you've got to just be a little flexible. Then my next book will be on flexibility, because be a little flexible. Anything on earth will bend, for you. The world will bend backwards for you if you choose flexibility.
Which means be receptive to these new ideas.
Plasticity, neuroplasticity.
And accept the fact that you can change the way things are.
Absolutely. People say, but I was born like this, I think like this. No, you can change. Cradle to grave, you can change. Now, where are you? You're obviously somewhere in the middle. Because if you're inside your grave...
But I understood one thing is, it's not going to happen like that, and it's going to require repeated, consistent efforts. So
Yeah.
today, that's the main learning, that it's not going to happen like this,
In a
and it's going
snap.
to require.
But trust me, it
Ah.
can happen in a snap also. Sometimes one statement changes your life. I get that a lot from people, and I don't even know which statement to narrate, because like I give people this statement, who should I rely on the most? I said, you have to be your own safety net. That's it. I will be my own safety net. And if any, becomes your mantra, anything that happens in life, I have to be my safety net so I can deal with it. That pick any mantra that works for you, and it will start working. I mean, pick any mantra that you believe will work for you, and it will start working. But no bland affirmations. I'm a proponent of active action. So you've got to take action.
So I think what I'll let our audiences advise our audiences that read the book, buy the book. Next time you travel, pick it up at the airport, buy it on Amazon.
Yes, it's on every crossword at the airport.
Yeah.
At some point, you might find me at some airport on a book signing, because I told the crossword, every time I'm flying somewhere, I will be signing some books. So they said, okay.
Yeah, written by our friend, by our colleague, and it's in a very conversational style, as she has picked it up for you. And I would advise you to read the book from beginning to end. You would not want to read it.
And go slow. It's
Hmm.
sometimes you may take like 3 days just to for one chapter, just to
Yeah, so there are
absorb it.
some parts in which you are going to be identifying what she's talking about, and there that you go through a little faster, and then suddenly there are these checklists, and then it compels you to think. So then you get a little stuck on those few pages. So it's going to take a while for you to finish it, but it's your mantra to change your belief to an adverse life event. So if there's something which is never going to stop, it's adverse life events.
Correct.
And the only way we can handle is by changing our
Change
beliefs
your
towards the adverse life event. So
Correct.
with that, I think we should conclude our today evening's conversation. Thanks a lot, Shefali. I hope your book does really well. And
Thank
next
you.
year we come again on Ortho TV interviewing you for
Next
yet
year,
another
I will
series.
come again before that without a book, where I don't think I'll come up with a book so soon, but I will come and talk to you again.
Great, great. Thanks a lot. Thanks a lot, Ortho TV, Neeraj, Bijlani, and Ashok Shyam for having us here. Thank you very much.
You.
Bye.
Bye.